Hello and welcome to the Healthcare Huddle video podcast. My name is Rachel Slawson and I am your host. Following on from our last episode, we will be talking about how we consider leadership and staffing whilst undertaking an investigation into transmission of Covid-19 within health and social care settings. We will be talking with Leslie Underwood, registered nurse and public health professional. Leslie wrote an article entitled Investigating Transmission of Covid-19 within Health and Social Care Settings. You can find a copy of this article at the Fascia Melius website, and that is fascia-melius.org.uk. We will also have a link in the description, so if you don't take it down from me just saying it, you can find the links down below. We are recording 5 episodes around this topic, and these are all aimed at healthcare professionals within health and social care. And this is our 4th episode, so we're near the end, and we need your help for the 5th episode because it's all about a question and answer. So we need you to submit your questions and we will try and answer them. We want to thank our sponsor today, who is Fascia Melius, who have sponsored this whole series of podcasts. They are a healthcare consultancy firm which offers a unique combination of insight, innovation and experience. They specialise in quality, governance and patient safety investigations. Hello Leslie, how are you doing today?
I'm fine, very well, thank you. You?
Yeah, I'm good, thanks. I can't believe it's the 4th one.
It's gone very quickly.
It definitely has. So today, as I said, we're covering leadership and staffing. But do you want to give a bit of a background on how the article came about and this series of podcasts? By the way, we would suggest that you go and watch the other podcasts. They will be in the link in the description below. Definitely check those out and then come back and visit this one. It'll all make sense then.
Okay, sure. As you said, I'm a nurse, but I also have a background in public health. And I suppose for the majority of my career, I've looked at patient safety, I've looked at governance, and I've also looked at serious incident investigation. So I suppose sitting here reflecting on COVID and how it's affected people, I started to think, I wonder whether anybody started to do that official reflection, if you like, the look back, the debriefs, what went well, what didn't go quite so well, and in some cases where there was transmission in healthcare settings, whether or not they've considered doing a full-blown serious incident investigation to see what happened, how, when, and if it does happen again in terms of wave 2 and 3, or even down to seasonal flu and the effects that will have with it, whether we will be prepared next time.
Yeah, definitely. Massively important topic to be covering right now. During an investigation, what would you consider in relation to leadership?
Well, leadership, like everything else, has got so many elements. And when you look at investigations, there's so many elements you would like to look at. So, for example, how was the team led? How was it managed? How much information did they have? How were they supported? All those things actually impact upon how well a team will do. So when you start to look at it, you start to talk to people, you start to get the feeling of how well managed they are. A well-managed team will support each other and will usually run themselves. You can have a very light managerial touch, but actually you can really support your staff while you're doing that. So what I would be looking at is, in terms of COVID and the team, how high up were the preparedness starting to take place? So was there board level involvement in that? Was the board dictating what the team should be doing and how they should be doing it? Were they getting them ready for COVID as we knew it was going to be coming along? So those sorts of things. But then there's also things looking at drivers for the organisation itself, and there will be different drivers. So it might be that in health and social care, in terms of national organisations, they're really, really focused on the here and now and the patient element of that. But if it's a private organisation, there might be other factors involved in that. Whilst patient safety is very high on the agenda, there might actually be implications about costs. So if you look at PPE, for example, the costs of getting PPE were enormous, and prices rocketed throughout the pandemic. Did that have an impact? So how prepared was that organisation? Had they stockpiled? Had they expected PPE to come in from somewhere else? So there's all those sorts of elements which really come under leadership but don't, because it's like a two-way thing. So I've put them under leadership for people just to consider, because I think it's important. But if that team is well led, those staff will raise concerns, and they'll feel happy raising concerns. It'll be an open team, an honest team. They'll put their hand up and say, I'm really struggling, help me out here. Whereas if it's a team that's sort of managed by somebody who's not quite that receptive, there will be difficulties for staff to say that. They won't feel quite as safe in saying that. So I think it does impact. I think there's a huge impact there. But suffice to say, human factors plays a huge, huge element in all investigations, and really can't be forgotten in any of them, whatever you're looking at.
Definitely. Such a big topic and so important, and how the whole situation is managed, how the whole team feel going in, how they feel during it, and how they feel coming out of it. The right leader can make such a big difference.
Yeah, a simple thank you at the end of the day is wonderful, but a meant thank you, one that's really meant, can make a huge difference.
So, can you talk to me about risk management in the context of an investigation?
Yes, certainly. In normal risk management, we would know what we were dealing with. In pandemic situations, it becomes slightly more difficult because the boundaries move, the boundaries change, and in some cases, the whole goalpost game changes. So you would know your normal risks, and those would be part and parcel of any investigation. So, whether it's a risk to the service user, whether it's a risk to the organisation. However, during Covid-19 and the pandemic, there were special risks that started to play. And I think these are important and should be looked at. So, for example, if you're looking at locums and agencies and then working within the organisation, now it may be they're long-term people who've worked with the organisation for a long time, and that's brilliant because they know the routines, they know the people, they know the staff, the systems and the processes. But actually, and I know we're moving on to staffing, but if you have a low staffing level and you have to bring lots of extra people in, those risks start to escalate because people don't know the service, they don't know the system, they don't know the process. So there are extra risks involved in that. But then you've got things like bed pressures. So we know ICUs were struggling at times. We know the Nightingale hospitals were put in, that's great. But there were pressures to get people out of hospital and into residential care and back into the community. So there were risks there, both for the NHS, but also for community services. So how well was that managed? Did that play a part in anything? It may be a simple, yes, we've looked at that, that's absolutely fine. But actually it may be, well, we could have managed that a bit differently. Do we need some sort of protocol in place next time to make sure we manage it better? Service provision, we know there are issues with service provision. We know some services were just halted completely. But when we're looking at COVID, what impact did that have on the services we provided? And did that cause any knock-on effects to other services? So whilst this is about COVID, actually there might be some incidents that have occurred in other services that you might want to look at as well. So it might be bigger than just COVID. Just while I'm thinking about it, would be commissioners and pressures from commissioners. So, either fill the beds or empty the beds, whichever way it goes, what impact does that have? So you're really looking at how this impacts what you're doing and how you do it, and what effect did that have on what you're investigating.
Absolutely, and the whole system. It's not just it's not just that one service or that one hospital or that one trust or that one provider. It's that downstream effect that can have on the whole, effectively, ecosystem of health and social care. It has a huge impact and must be considered. So, would an investigation cover culture within an organisation?
It wouldn't automatically. But that said, when you were talking to staff, if you were picking up that there was a potential issue, then yes, you would. It's certainly something I would do. So I'd be looking at whether staff could have frank, open discussions, whether they felt able to do that, whether they felt able to raise concerns, whether they felt supported, and empowered, because obviously empowered staff actually manage change far, far better than people who feel that they're downtrodden and beaten up, and we're always the underdogs and we're always being told off. So certainly I would say yes. In terms of things like adherence to policies, if the policies aren't able to be challenged, people will find their own ways around them, so policies won't necessarily be stuck to. And it may be the policies aren't right, but actually if people don't feel able to speak up about them, then they will find their own ways around. They'll find quicker ways or different ways of doing it that may not be helpful. But there is always this balance about risk and safety and how you express those fears up to management. In how you do it. You may be seen as the person who's always making those complaints, who's always raising concerns, and you just get ignored because, but actually that this one time you're doing it might be the time that somebody needs to take notice. So the whole culture obviously is hugely important, but you will feel that when you go in to do an investigation, and certainly if you're in it, you will know whether or not you need to look at it. That said, if you have that sort of organisation where the culture isn't open and honest and transparent, actually you might want to start looking at an external agent to come in and do it.
In regards to staffing, what areas should people be considering within an investigation?
Okay, so any investigation, you would look at staffing. You'd look at the number of staff that should be on compared to the number of staff that were. You'd look at the skills and the qualifications of those staff. As we said before, you'd look at the training of those staff. With COVID, we know we had staff shortages. So if you look at the bigger picture of COVID, we had staff isolating at home. We had staff shielding at home. We had staff who were isolating because they were in contact with somebody who tested positive to COVID. So all those sorts of issues which we know reduce the staffing levels. So that's your starting point. What staff should you have had? How many did you have? What did that staffing group look like? From there, you would probably move it on to, did you have the right qualifications within your staff? So if you are supposed to have, 3 qualified staff, 2 support workers, a physio and an OT, is that what you actually had, or did you have something completely different? So that would be part and parcel of it. Not necessarily to pick fault or to say it was wrong or anything like that, but to actually state the fact. The fact on this day was, this is what we had. You'd also look at whether those staff had been on long shifts. So had they been on a 10-day stretch? Had they had rest breaks? Had all the sorts of things that impact on people's ability to do their job well, as part and parcel of your what I class as staffing, that you need to look at staffing levels.
So, Leslie, we have now got to the end. I have a final question, open-ended. Are there any other topics that we haven't covered in this series?
I have to say yes, there are. There are so many elements to undertaking an investigation if you're looking at a full-blown serious incident investigation. Other things, if you're looking at COVID specifically, things like were the decision-making aids available? And by that I mean test results. Were they available in a timely manner? Could you actually make those decisions based on results? Things like the patient themselves, and the person who contracted COVID. What were they like? Did they have underlying health conditions? Were they able to understand instructions given to them if they were still mobile and out and about? If they had dementia, what impact did that have on their behaviour in terms of were they able to understand what you needed them to do? But also, as I said way back, it seems like forever ago, when we talked about involvement and being open and honest with families and with patients, if patients and families are involved, then the investigation needs to look at what they want to understand. So as part of your terms of reference, you will have questions that they have posed. So some of them might be off on a tangent and totally outside of the investigation, which is fine because you just acknowledge that and pass it on to whoever needs to deal with it. But if they are part and parcel of the investigation, then obviously those elements would need to be looked at too. And that could literally be anything. So, it's as broad as it's long in those terms, and you just wait for those responses and deal with them as they come.
Yeah, and really the whole central point of this is to improve patient care outcomes, also the carers' support and the outcomes that they want for the person they're caring for, and to support the staff so they're working in the best environment that they can in these hard circumstances, but they've got an environment that's supportive, they feel they can be open and honest and can learn from things so that they can make sure they don't make the same mistakes twice and feel prepared potentially if there is another wave.
Yeah, but also, as I said, things that went well throughout the whole thing, let's praise those. Let's get those out there. Let's get other people learning. Because actually, if one team can do it really, really well, others can. They just need to know how. So it's about sharing that learning and spreading that learning around so that people understand how it can be done well. I go back to, this isn't about beating people up. This is about sharing good practice. This is about learning from when things went not quite so well as they should have done. Let's not call it a problem. Let's call it a challenge. Let's deal with it and let's look to make it better the next time round.
Definitely. And working with those outside agencies as well and garnering that relationship so you can have an open dialogue about what worked for either of you. I always think ambulance trusts and social care and your A&E department and then your wards and all of it needs to be considered because I'm sure that there's a lot of feedback from everybody about what could be improved.
And whoever was involved, you would involve them. You would talk to all of them. And then that way you've got all angles, you've got all sides, and you can make the understanding there for everybody. People need to understand other people's roles. That's another thing that we're not very good at.
Well, thank you so much, Leslie. It's been so interesting sharing your wisdom with me. It's been really, really, really interesting, and I'm very grateful that we got that time with you. If you want to read the full article, it's on the Fascia Mellius website, which is fascia-mellius.org.uk. The link will be in the description below, and it is spelt FACERE-Mellius, MELIUS.org.uk. You can also follow Fascia Mellius on their LinkedIn or Twitter, and we want to thank them so much for sponsoring this series of really, really important podcasts about this really, really big topic within health and social care. I'm really, really pleased that they managed to do that. And we also have created, you've created a downloadable checklist, which is available on the Fascia Mellius website, which will help and assist people who are undertaking an investigation into transmission of COVID between patients and potentially staff. So definitely go and check that out and download a free copy. You can do that right now. As I said, we're creating 4 podcasts. So we've created 4 podcasts. They'll be released on Tuesdays and Thursdays. And the final podcast will be a question and answer. So we need your help for that. We want you to be involved. We want you to submit your questions and hopefully we will be able to answer them. Leave them in the comments below or head over to Twitter or LinkedIn and respond there. We'd really love to hear from you and get your feedback on how you found this series of podcasts. If you are joining on YouTube, please like and subscribe and hit that notification bell so you can get notified of our next upcoming video. And if you're listening on podcasts, then definitely subscribe. All right, thank you so much for listening to the Healthcare Huddle podcast. Please like and subscribe, as I said, stay safe, and we will see you next time.